are here for another evening, another segment, another day with talking about Medicare. For all of you business owners that are out there, you know how it is. There's Medicare, there's Medicaid, there's private, there's all these different things going on. And sometimes we actually get positioned to have to answer some of these questions for our customers and our consumers as to what am I entitled to? Does this cover this? Does Medicare cover any of my home care so that I don't have to pay out-of-pocket expenses? There are so many questions out there, but today we have our guru in Medicare and a Medicare Advantage Plan. Miss Thea is here with us from Medicare Insurance Solutions. Welcome, Miss Thea.
Thank you. Thank you. I am so excited to be here today. So, what an honor to be invited. Thank you
Oh,
so much,
you
Yvette.
are more than welcome. So, myself and Miss Thea had met through Thea being on stage in some pretty large conferences in South Carolina. And just knowing the attention that she was bringing and how she was conducting herself and her business, very professional, that, I wanted just to tap into Miss Thea and been able to give me some knowledge and understanding of the Medicare plans and how it works. But more intriguingly is how she is here to help others get to what they need to have and how to plan to get to what they need. So Medicare Insurance Solutions is here as a free consultative service. So let's get right into it, Miss Thea. Tell us about Medicare Insurance Solutions. Tell us about you and your team.
So, Medicare, as a Medicare advocate, I've started specializing with Medicare plans nationwide over 16 years ago. However, I have been blessed to have opened my own agency 4 years ago, still doing the same thing. So, basically, what I am is, like you said, I am a Medicare guru. A Medicare consultant, if you will. So,
Yes.
my job or my goal is to assist Medicare recipients with the complexities of Medicare. It can be very overwhelming, it can be very daunting, very confusing, absolutely. So, what I do is I do kind of a holistic approach in custom designing each person's needs for their Medicare coverage. I,
Right.
I do a deep dive. I even do help them compare if they're currently still actively employed. I even help them compare whether it's best to keep their group coverage or leave that, or if a person has Medicaid, I look for other options where they can avail of other services. So it's a very holistic and very analytical approach in kind of analyzing what is the best advice for each individual Medicare recipient, considering all factors such as medications or
Right.
doctors or hospitals
Right.
that they continue to see.
And that leads me on to the question, because as we know, we started from Medicare Part A, and it's like gone down to the, tail end of the alphabet and some things tucked in between.
Hmm.
But we know that there's the Medicare Advantage, which is now swimming around on the circuit. And again, the understanding of what that is and what it does is pretty much a mystery.
Hmm.
So why are there so many of these plans? And what are the differences?
Okay, so basically, there are four original parts of Medicare, not plans yet, parts.
Parts.
The parts of Medicare are A, B, C, and D. A and B are the federal benefits of a Medicare recipient. That is their entitlement of
Hmm.
having generally worked in the United States for at least 10 years. And then C and D, Part C actually is a Medicare Advantage plan that's like an HMO or a PPO, for example. These are managed care plans that almost takes the place of Medicare and becomes primary to Medicare so that a person gets to avail of these services and all of a person's plan in terms of medical, hospital, and prescriptions are all covered under one plan. And these are offered through private insurance carriers. So a lot of folks may want to consider those because those offer minimum copays. And what's important is with Medicare Advantage plans, they are protected by what's called out of pocket maximum. which means the copays will stop at some point. So there is some type of protection offered with Medicare Advantage plans.
So I lost you a little bit there. So you're saying that these are offered by the Medicare is not being offered directly through the federal government. You're saying these parts can also be offered through the private insurance.
That's correct. So A and B are
Mhm.
offered through Centers for Medicare and Medicaid Services. That's Medicare. A person applies for Medicare Parts A and Part B through the Social Security office. Now, given the fact that generally Medicare only covers its recipients 80%, so
Right.
there are generally three options. It's either they keep an employer plan, a retiree plan, but if those are not an option, then they either go with a Medicare Advantage plan, which is the part C, like in Charlie of Medicare, that covers, and this is going to get a little confusing. The part C, like in Charlie of Medicare, covers A, hospital, B, medical, and D, like in David, for prescription, all under one plan.
Ah, got it.
Yes, like a regular
Okay.
insurance.
Oh,
Yes.
phew. I need a drink now, Miss Thea.
Well, that's why I'm here to help simplify all these letters.
Exactly, exactly, exactly. And it does most definitely, lead into like why you do what you do. And, and one of the things that you said that you was an advocate. And I truly believe in that advocacy part of what you do. It's not just about being a consultant and giving out information. It's really truly for you about making sure people get what they need.
Absolutely.
Right. And to me, that is just so very, very important. So we've got the A, B, C, and D. Medicare C, which is the A, B, and D, but under one roof, the
That
Medicare
is right.
Advantage. There's premiums to those as well. So what
That
does
is
those
correct.
premiums look like, Thea?
So, Part A, there's generally no premium for folks who have worked in the United States for at least 10 years because they've paid for that while working, right?
Right.
And
Mm-hmm.
then Part B, like in baby, can vary. The Social Security office bases it on the past 2 years adjusted gross income. So now that it's 2022, it's based on 2020 adjusted gross income. The average Part B, like in baby premium, is about $170 per month, but it can go as high as $578 depending on the income, right? And then
Okay.
on top of that, if a person wants to enroll with an Advantage plan, those generally are available at low premium or zero premium plan, right? But
Mm-hmm.
there are co-pays associated with each service, but it generally tends to be no longer the 20%, but it's flat copay, meaning it's a flat dollar
Right,
amount.
right, right.
So to a recipient, it's advantageous because it gives them some type of predictability to kind of
Sure,
budget,
for budget. Right,
right,
right.
for budgeting
Absolutely,
purposes.
absolutely. And then how would you, and I'm throwing questions out at you right now.
Please.
Um, how would you then determine which of those private insurance, I mean, aside from using Thea as my advocate and my consultant to find out which one, how would you best gauge, selecting that right carrier for that advantage plan?
It's a very good question. So, the first step I need to find out, right, for me to match, because it's like a dating match.
Right, right.
So, we have to match Mr. Smith with a good plan, right? Because that's it for life. So, the first thing we need to find out are obviously their preferred providers, whether it's a
Mm,
preferred doctor, specialists, laboratory, hospitals. Most people, a doctor is very important if they're comfortable with that and they don't want to let it go. Like I said, these are managed care plans, meaning the providers also are contracted with
with
whether it's ABC
right.
company or DEF company. So that's very important. Another thing that's really, really very important are the medications, because
Mm,
all of these insurance carriers design their plans with different drug lists, drug tiers, and copays. So, for example,
wow.
I don't know, an Advair may be a tier three preferred brand with one carrier with a $42 copay, but with another carrier, it could be a tier four non preferred brand with a 47% coinsurance. So, it is not a 5-minute decision. It really has to be treated like a blueprint, so to speak, right?
Right, right,
So
right,
we
right.
have to make sure that a person has a very good plan so that he's ready for the rest of the calendar year.
It really comes across to me that, the time that you have to spend, is that not just a quick 45 minutes discussion, let's have a cup of coffee, let's have some, cucumber and cheese sandwiches. It really is an in-depth process that you have to go through. Now, you mentioned about the medications. Are there those plans that there's some of those medications may not cover, and
Mhm.
or that if they do cover them, they may only, for example, have brand as opposed to generic, which now
That's right.
inflates, right? So you have to look at all those different moving parts.
Absolutely. It's very in depth. That's the exact word. Yes. All of those moving parts. And that's why I say holistic. I look at it as a whole approach. And for the most part, if I review somebody who already has a plan, I take time. It's a minimum of an hour. But if
Mhm.
I find, like during the annual enrollment period, some people still come and want me to review their current plans. If I find that their plan is still the best, I recommend for them to stay.
Wow.
So it
Right, right.
really is a case to case basis. Even husband and wife do not have to have the same plan.
Okay. So let's do this. I want to get into and really scratch the surface in terms of, the premiums and those different tiers, in terms of what does a Medicare Advantage plan look like, right?
Hmm.
And then, there's the supplemental plans,
Hmm.
and there's also those gaps in the plan,
Hmm.
right?
Right,
That's,
right.
that's what you taught me, Miss Thea. So I have
Yes,
to listen. I hope I get points for that. So
yes.
let's take a few moments. Let's take a break. Let's come back. Let's delve into some of those numbers, and then let's look at the nuances in terms of what they do have, and the flip side of that pancake in terms of what they don't have.
Beautiful.
Sounds good?
Absolutely.
All right,
Thank
then we're
you.
going to be back in a few moments.
Perfect. Thank you.
Whew, it's been a lot of information, Miss Thea. She's rocking my world right now. But we are going to get through this. We're going to collect all that information that we need. And again, you can't get all that information in a 20-minute, 30-minute segment. So but again, we want to press on, and let's delve right deeply into the Medicare premiums portion.
Okay.
So what does that look like?
The Medicare, original Medicare premiums, the minimum is $170.10. So it tends to increase sometimes, depends on inflation. But right now, that's the minimum. When I started, oh my gosh, over 16 years ago, it was under $100. But right now, it's gone up because of inflation. But some people may qualify for what's called the Medicare Savings Program.
Okay.
So those are being offered on an income based level. So, for your listeners out there, I suggest that they contact the Social Security office. It's 800-772-1213, and they can simply ask if they qualify for what's called Medicare Savings Program.
Medicare
To,
Savings Program.
that is correct, to help with the Part B like in baby premium. And also, there are programs out there if you don't qualify for the state Medicaid program. There are also some programs called Extra Help that's help to pay for medications, especially for those of you folks who take non generic medications that can have high copays.
Right, right. Awesome, awesome. So we have one of our listeners who is putting up some questions. So I wanted just to position that to you, if you wouldn't mind, Thea, if we just take a little bit of a sidestep here. So Brittany Duncan, she says, is it true they only approve about 2 hours a day? Um, how does that work in terms of the Medicare Advantage, in terms of, the assistance that one may receive?
So that all depends on the carrier and what the doctor certifies. That's a very kind of gray question. I could not give a direct specific answer. There are different carriers and there are different approved hours based
Hours,
on an
authorized
insurance
hours.
carrier, based on the county, based on the region, based on the state. So um,
Right,
that I would recommend to contact the carrier directly. And that's one of the reasons why, in searching for an Advantage plan for a specific recipient, that's another need that I may need to fill, to match that person with something that has a good, I'm assuming home health care is what
right,
she's
right,
asking. Yes, ma'am.
right. Absolutely, absolutely. So, flip side of the pancake, Dr. Phil always used to say there's two sides to a pancake.
Hmm.
And I love that saying. So the
Yes.
flip side to that pancake is, what does Medicare not cover?
Oh gosh. So, all right, are you ready for this?
Oof.
Okay, so there are two original Medicare, like I said. Those are Medicare Parts A, like in Apple, and B, like in Baby. Okay, I'm going to start with that. The
Okay,
Medicare Quick 101 Basic.
okay,
Part A only applies to inpatient hospital, skilled nursing facility, home health care, and hospice care. So
correct.
generally, there's no premium for Part A, but if a person is admitted to a hospital as an inpatient without any other plan, the standard Part A deductible is 1,556 per benefit period. It's not even per
Right,
calendar year. Okay.
right,
And then after 60 days, it's close to $400 a day. After 90 days, it's over 700 bucks a day. So if a person is in and out, there is no cap. There's no out of pocket maximum. The bills can go on and on. That's inpatient hospital. And then skilled nursing, keep in mind, Medicare does not cover long term care.
correct.
Skilled nursing is very short term rehab where a person is only covered for the first 20 days. And then from days 21 through 100, a person has to pay 194.50 from days 21 through 100. And then, as you know, home health and hospice are covered by Medicare
By
100%.
Medicare, right, right.
Right,
And I do also want to just to make sure that everybody is very, very clear. This is Medicare, not Medicaid.
right.
Okay, so there's a couple of there's it's most definitely a difference. So we want to make sure that we're
Absolutely.
clear with that. Medicare, which is the obviously the federal program, but as Thea said, it's triggered by that short-term stay, the hospitalization, your 20 days in subacute rehab, 21st day, you're going to get discharged. And then generally, if you do extend up to your 100 days, then Medicare do actually provide the coverage, but there's also a higher percentage out of pocket that you would have to pay as the patient. So I want to make sure that we understand that. And Medicaid is for the low income. So I always want to
Right.
preface that. Okay, then, Miss Thea, I just wanted to make sure I jumped in with that. So what's next?
Well, and then the part B. B is anything under medical, doctor's visits, surgery, emergency therapy, MRI, CAT scan. Those generally are only covered 80% by Medicare. And then Medicare, like you said, Medicare, the federal program benefits, will also not cover dental, vision, and hearing services in general. So that those are what Medicare does not cover. And that's where I come in to help
Right,
folks, fill in the gaps of what
right, right.
Medicare does not pay.
Exactly. So is that part of the supplemental plans that you was referring to?
Right. So, one option we covered earlier are Medicare Advantage plans like HMOs or PPOs. And keep in mind for some of your folks who may be listening who have full Medicaid, for example, because
Mhm.
Medicaid, state Medicaid programs also comes in different levels, right? Some people have full Medicaid, some people have partial Medicaid.
Correct,
But
correct.
but for the lucky ones who have Medicaid, there are also what's called special needs plans, HMOs and PPOs available to them, which pretty much gives them additional coverage, perhaps some more dental services, some over-the-counter items, free membership to health clubs. Um, Sometimes they also get a lot of bonuses with the special needs plan. Those are available. Now, I'm sorry if I just touched on that real quickly. I didn't want to miss it. But now that we have a full understanding of Medicare Advantage plans, right, that pretty
Mm-hmm.
much almost takes the place of Medicare, we move on to supplements. So, supplement plans, commonly known as Medigap plans, are one and the
Ah,
same, right? So,
right.
it supplements or it covers the gap. But this is going to get more confusing, Miss Yvette, because they're also coded by letters.
Oh my God.
But
Oh,
but they're not parts. These are now Medicare supplement or Medigap plans, right? So when you hear folks talk about I have a Medigap plan A, plan F like in Frank, plan G like in George, plan N like in Nancy. So during these time, the most popular ones now, I'm going to trim it down, are either plans F like in Frank, G like in George, or N like in Nancy. So, to alleviate confusion, at least it's not Medicare Parts A, B, C, and D. It's
so it,
Medicare Plans F, G, and
right.
N.
So I mean, they couldn't like figure out another letter in the alphabet instead of doing part whatever or plan whatever, right?
Right,
I,
right,
I
right.
need to put in a call and have a discussion with them because clearly,
Believe me, we were trying. I'm kidding.
clearly this may not work for us. So we've got parts A, B, C, and we've got
Hmm.
plans
As an
K
option.
as options,
Well,
which is
there's a Plan K
Medicare.
too. That is
Right.
correct. So there's
Exactly.
plans F, Plan G, Plan N, for example. But to differentiate, right?
Mhm.
So these plans are designed to cover just medical and hospital.
Right.
Keep in mind, Advantage plans generally cover medical, hospital, and prescription all rolled into one plan. Some Advantage plans only cover medical and hospital, but those are generally designed for folks with VA, right? Prescription
Okay.
coverage through the VA.
Right.
But supplement plans really only cover medical and hospital, period.
Okay.
Okay.
Got it.
But contrary, it's almost like the opposite because supplement plans, you pay a premium upfront, but generally no copays. Keep in mind,
Mhm.
Advantage plans generally available at low or zero premium, but you kind of pay as you go
As
for
you go.
copays.
Right.
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 Supplement plans, you pay a higher premium upfront, but when the fan hits the wall, you generally don't have any copays. And the big tickets that we have to keep in mind with Medicare are dialysis, surgery, MRI, CAT scan,
Sure.
chemotherapy. So
Sure.
those are the big, or hospitalization or skilled nursing. When you have a supplemental plan, you pay a higher premium and it depends on the state that you live in,
Hmm.
right?
Hmm.
So you pay a higher premium, but you don't pay those copays. But I don't want to forget this. In most states,
Hmm.
the only time a person can purchase a supplement plan without having to go through medical underwriting only happens once in a lifetime. So you get a free pass, okay? And that generally only occurs
Hmm.
within 6 months of turning age 65 and within 6 months of the Part B effective date. So
Okay.
it's almost like you need to get it right the
Get it
very
done.
first time. That is
Absolutely.
correct, especially for those
Absolutely.
who have a lot of health issues,
Right,
right?
right. Gotcha, gotcha. So we have another message that's popped up here. I'm going to throw this out to you. The question is, how do we provide services for someone that has Medicare?
So, as a home health care provider,
Correct. So I'm assuming Miss Wendy Franklin, who has posted this, is home care owner. She's saying, so how do we provide services for someone that has Medicare?
so the best approach is just to call 1-800 Medicare and get connected to provider services.
Right. And I also
Now,
want I just want to just jump on that also. And just to say that, depending on what state you are in, there are many states that what we call have a certificate of need. They're a certificate of need state, which is meaning that there's going to be many other different criterias for somebody to go out there and get Medicare or to be a Medicare provider. Thea, you and I had this discussion at some point, also with regards to becoming that Medicare Advantage provider.
yes.
Um, and there's still so many unknowns with that, right? And I do know that Thea has been, beating the path, getting her name out there, asking these questions as it relates to being a Medicare Advantage provider.
Provider.
So do you want to just to add on to that as well, Miss Thea?
Absolutely. So as a Medicare Advantage provider, you just have to contact the insurance carrier directly because like I said, Medicare Advantage plans are managed care plans, so you have to be contracted with that specific carrier directly. So that's pretty much how it goes.
Okay, perfect. And the lady, Miss Wendy, she stated that she's in South Carolina. I have Lakia Gaines, who has just asked, is there a credentialing process?
I'm pretty sure there is a credentialing process with each Medicare Advantage plan because they are highly regulated by the Centers for Medicare and Medicaid Services. So there is absolutely a credentialing process.
Absolutely, absolutely, and I think more stricter than the commercial insurances that we speak
Yes.
about is going to be pretty grueling, guys. But most definitely, you got to cross your T's and dot your I's and make sure everything is in place before you even admit a client, a patient. But as Thea says, if you want to try to look for the Medicare Advantage and be a provider, go to the website and go through that credentialing process. So who is a good customer for you, Thea? Let's wrap it up with who is that right customer for you?
Oh gosh, every single person is a good customer for me, even if I don't sell a plan for a customer, because my business is based on a referral basis. I always do what's best for the client. Like I said, if I find that what they have is a good plan, believe me, the universe comes back and gives me referrals. So that's how my business works. It's really on a referral basis.
Wonderful. And in closing, and as I ask all of our guests that come on to our broadcast, is that what's going to be those lasting and ending remarks that you want to say to all of the listeners, whether they are business owners who do have these clients that sometimes are searching for that right plan, that right situation. Um, what's going to be your lasting and final words to those who are listening today?
Okay. So for you business owners and your potential clients or anybody who's listening right now who are Medicare recipients nationwide, I understand, I speak the language. I know how overwhelming and confusing it can be. Don't fret. I am here. Call me anytime. What we do is we do provide you the services that you need to alleviate the confusion with Medicare. I promise you that I will always do what's best for you, even if it does not mean that whatever plan I provide you will not be the right fit for you. But if it's the right fit, then come on board, join my family of happy members. We also do provide a lifetime customer service at zero cost to you for life.
You are absolutely amazing, Miss Thea. Your energy is just contagious. You know that you and I still have to talk. We have to continue our discussions from the last discussion. But I just thank you for being here. I thank you for sharing your knowledge. You are truly have passion for what you do, most definitely. So again, guys, we have Thea, who is here from Med Eye Care Insurance Solutions, who is here, who's providing advocacy, consulting to your clients who may need or may want to look at their alternative options for
Mhm.
Medicare coverage. She's right here. If you need her information, please contact us. We will get you guys connected. But in the meantime, I'm going to say thank you once again, Miss Thea. I'm going to look forward to speaking to you shortly, and I'm going to look forward to speaking with you and doing business with you again in the future.
Absolutely. Thank you so much, Miss Yvette, for giving me this opportunity.
You
Thank you.
are
I'm very
welcome.
grateful.
Thank you so much, Miss Thea. Stay in the broadcast. We're going to be right back with you. But for everybody else who's there listening to us, thank you very much for being with us. You can always hit us up on our YouTube. Please go back and look at our recordings on Facebook. But for all of those who are asking us questions, Miss Wendy, thank you so very much.
Thank you.
Crystal, I know that you're late, but yes, you could go hit the replay. We have Brittany. Thank you so much, very much for your inclusions and your questions. Lakia, yes, there is a credentialing process, my love. As always, there is everywhere we go, unfortunately. But thank you very much for being part of this session. I appreciate you all. And until next time, I'm going to say good night.
Good
Good night.
night. Thank you.
Night.